So, good afternoon, everybody. My name is Michael Swift. Firstly, I'd like to say thank you to SciES for having me today and for their great campaign that they're currently running at the moment. Fortunately, I'm stuck in sunny Birmingham in the UK at the moment, so things aren't too bad, and I hope that you're all well. So, as I said, my name's Michael. I'm a private psychotherapist in the UK. So I mainly specialise within health anxiety, psychosomatization, and a majority of disorders that do revolve around anxious individuals. So my main role is as a psychotherapist, so I use a lot of the VR that is already provided by SciES, and I'm also a neuroscience practitioner trained in a treatment called RTMS for anxiety and depression as well. So let's just have a little look. Okay, so just a little bit of a rundown of what we're going to be having a little look at today. So this is mainly going to be just a brief introduction to what health anxiety is. So we're going to have a look at what specifically the condition is, how health anxiety tends to start, how it precipitates and perpetuates. And then we're also going to have a little look at how we can help manage health anxiety and a few steps that's taken a little bit from cognitive behavioral therapy and a little bit from acceptance and commitment therapy as well, and hopefully tie those all together and provide you a little bit more information on how you can help manage some health anxiety if you do have that at the moment. So the first thing to note, obviously we're in a current climate that's quite concerning at the moment. There's a lot of instability in the climate, and there's obviously naturally a lot of fear around the current coronavirus pandemic. So, we've seen particularly in clinic and from the statistics that a lot of people are, really concerned about this virus for both themselves, for their loved ones, their friends, and overall it is quite an anxiety-provoking time. So I think the first thing to mention is that health anxiety in itself is a completely normal and natural way of your body trying to protect itself from what it perceives as to be a threat. So how the anxiety system works is primarily that, So primarily works that if you are in a state where you believe that, you're being threatened, kind of caveman instinct kicks in, and our adrenal system, as it's called, and that typically kicks in our fight or flight response, which serves to protect us. Unfortunately, that sort of response nowadays isn't as effective, particularly when there's something that we can't perceivably fight or run away from. So for the example of coronavirus, there's not many ways that we can run away from it as much as we all would like to. There's no direct way that we can fight it. So anxiety is a normal state to be in, and it is somewhat good to have a little bit of anxiety because that is what keeps us safe and does protect us. The issue tends to arise when that anxiety becomes quite overwhelming. So when anxiety that is particularly health related starts to interfere with our day-to-day activities, maybe our work life, our social life, our relationships, or maybe if it just stops us from doing, our everyday tasks, such as going to the shop or something like that, that is where health anxiety can really start to have a negative effect on an individual. So looking at what health anxiety exactly is, there's quite a few definitions that have come out over the years, and within the DSM, which is the Diagnostic Statistical Manual, which looks at all of the disorders related to mental health and has recently been updated. So the textbook kind of response is that health anxiety is a preoccupation in worry about having a medical condition. And it is, some of the words are used interchangeably between illness anxiety, health anxiety, and it was formerly known as hypochondriasis. And this is typically a condition that's marked by, as mentioned, a person's imagination of physical symptoms or an intense fear of developing an illness. Within health anxiety, there are different definitions and criterion for what health anxiety is, and we're going to have a little look over those in just a second. But primarily, health anxiety is in essence the fear of developing a certain condition. So looking at the certain types of health anxiety, so this is a little bit of a breakdown of the certain conditions, and panic disorder is a little bit of a caveat that we'll come to in a little bit. So hypochondriasis in itself, in effect, is the old term. We've often heard hypochondriac, particularly in the UK, to describe someone who constantly believes that there may be something wrong with them. They're typically usually going to the doctors quite frequently and unable to get a sufficient answer from their doctors. So hypochondriasis is usually an interpretation of physical sensations that is catastrophic. So the typical example may be someone who has a headache. Most individuals would probably put that headache down to maybe not drinking enough water, maybe they've listened to too much loud music, maybe they haven't eaten throughout the day, maybe they've been sat at their laptop for too long. Whereas with hypochondriasis, the interpretation is usually that of something catastrophic. So my headache is due to an aneurysm or some underlying negative disorder that might be going on. So that brings us to nosophobia. So nosophobia is the phobia, so phobic in the sense of the word, and it is the phobia of developing a certain illness. So typically that is, in my experience, usually the fear of developing cancer, multiple sclerosis, or cerebral palsy, something like that. In terms of the current coronavirus outbreak, there's quite a little bit of nosophobia around developing the specific coronavirus itself. And the slight difference there between the hypochondriasis and the nosophobia is that nosophobia doesn't come from pre-existing physical sensations. So it's just a usually irrational belief that I will develop coronavirus for no reason whatsoever. So that brings us on to somatization. So there's something in psychology called psychosomatic. So psycho meaning brain and mind, somatic meaning body. So with somatization, there's typically a underlying physical sensation or something happening with the body because of something psychological going on. So the very common example is, for example, those who have eczema or psoriasis. So in some instances, those are conditions that are brought on by things like stress. So if somebody is quite highly stressed in the time being, they've got a lot at work, they're getting stressed with families, they can actually cause the condition that can come up on their arms or their back or wherever it may be. So that's actually the psychological impact having a physiological effect. And the final one, which isn't by definition a type of health anxiety, but has some crossover, is that of panic disorder. So panic disorder typically happens in two phases. So it's again a catastrophic misinterpretation of symptoms. So misinterpreting what is going on in the body, and then what we call a inability for, or a negative reappraisal of what happened. So the very common example is for those who may have a heartbeat that's going quite quickly. Often individuals with panic disorder will be concerned that they're either going to have a panic attack or that they're going to have a heart attack or something like that. So that can happen, a raised heartbeat can occur because of any reason, really. It could be, based on the diet that you're eating, exercise, it could be stressors, but the catastrophic misinterpretation is that of something negative. And how that is kind of reappraised, so the appraisal means the kind of interpretation and the meaning given to it is what tends to continue the issue. So this has a little bit of crossover, each of them for coronavirus. So if we look at hypochondriasis, for example, with bits of somatization. So if somebody, and it's quite common at the moment, members of my family have been thinking that they've got a bit of a scratchy cough, that they're sometimes struggling to breathe in the mornings. So within hypochondriasis, if we wake up and we feel that, okay, my throat is a little bit drier than it was yesterday, often, what we'll think is, well, I've probably just got a little bit of a sore throat. Some people who are smokers are much more likely to have sore throats anyway. Even down to the basic humidity of your room could have quite a large effect on on how your throat is. Within hypochondriasis, the usual automatic assumption would be, if I have a sore throat, I have coronavirus because that is the symptoms. And then we start falling into a little bit of somatization. So if we're getting more anxious and our physiological arousal is constantly increasing, then likely our immune systems are going to become quite decreased or not as effective as they are. And that is going to make us more susceptible to just general colds, general viruses. So there's not always a cause and effect between those two events. And hopefully that's what we aim to break down in terms of CBT or whatever therapy it is that an individual might be having. And particularly if you are listening today, hopefully that will give a little bit of insight as to what we're doing and the effects that it can have on us, really. So having a little look at these symptoms. So the main symptoms of health anxiety are quite far and few in between. There's quite a lot of symptoms that can arise within them. However, most frequently is the constant and the consistent worry about health. So that is a long and often chronic concern about your well-being. So that can be that you believe you're going to be unwell, you're going to develop certain conditions, and that just generally your health is not in a good place and it will have some negative effect on you. Another aspect of health anxiety is the inability to seek reassurance from medical professionals. So often with individuals who have health anxiety, they will not be able to take the advice of their doctors. They'll often think that the doctors have missed something or haven't got something quite right. And that becomes an issue in itself, really. So with the example of coronavirus, if we feel that something is wrong with us and that the doctors have possibly missed something, then that would be an aspect of health anxiety. Another typical symptom is frequent checking of body signs. So things like lumps, tingling, pain, identifying, scratchiness in throats, maybe feeling that your chest is a little bit tighter than it might have been. So typically there is this frequent and ongoing checking of physical sensations, which then again feeds the issue, really. A very interesting way of looking at this, and I would probably recommend you all to try, is if you sit back in your chairs and you close your eyes and notice a singular sensation that's going on in your body. So if I close my eyes now and I have a little think, so I've got a little bit of tingling in my right knee. So if you focus just solely on that tingling, and you can notice that often that sensation grows and becomes much more vivid than it was than when you just noticed it. And this is often referred to as selective attention or attention bias. So whatever we usually focus on that is negative tends to expand and tends to grow in both negativity and intensity. It's very common, really, and hopefully if you do try and go through that example yourselves, you might notice things in a slightly different way and realize that because you are paying so much attention to certain processes in your body, you may actually, again, kind of be perpetuating that issue and not allowing the kind of rational mind to take over there. And the final aspect of health anxiety that is, for me, probably the hardest part that I work with in my role is obsessively looking at health information on the internet or the media, or most places that do have any available news sources. So this can be, for example, looking consistently at what the symptoms of coronavirus could be, for example. It could be looking at treatments, it could be looking how many individuals have passed away, so mortality rates or recovery rates. And the issue you have with obsessively looking at this information, again, is that your attention, again, is focused on it. Whereas if we could move our attention and shift our attention to something, neutral or more positive, so, that could be just maybe enjoying the weather, then we can change that focus of attention so it isn't so specific onto the health and the health anxiety. Okay, so this is what's called a maintenance formulation, or a CBT formulation. So this is a formulation, and within CBT, a formulation, so within psychiatry, we have diagnosis, so several criteria will make a diagnosis. Within CBT, we have formulation. So formulation is more of a little bit of a story of what is happening, and a little bit of a jigsaw puzzle that we can piece together to really kind of get an idea of what's going on with an individual. So if we have a little look at this formulation, so typically there is a trigger. So within the example at the moment, the trigger would be the coronavirus outbreak and the current pandemic that we are living in. And from this trigger, we have a level of perceived threat. So, for example, my perceived level of threat from a satellite falling out of the sky and hitting me is, I would say, hopefully, touch wood, quite minimal. And because of that, it's not a threat that I perceive to be high, and it's not something that I particularly concern myself with. Whereas if there was a group of individuals stood out of the front of my house, for example, who had weapons, then I would perceive that threat to be quite concerning, and because of that, my fight or flight instinct would kick in. So if we have a little look at this formulation and we follow it around clockwise, so the level that we perceive the threat will lead into our worry. So our worry or our anxiety, I like to try and get a gauge. So you can do this kind of process if you're at home as well. So if our anxiety was 60%, for example, so, you know, we're quite worried, we're quite concerned. And there's two kind of processes that can happen here. So if we're feeling 60% anxious, that can automatically increase our physiological arousal. So physiological arousal being our physical sensations of anxiousness. So so typically the sensations around anxiety could be heart palpitations, it could be sweating or chills, there could be trembling and shakes, feeling like your legs are a bit jelly, so feeling a little bit wobbly. And there's a whole range of anxiety symptoms that you can have. So obviously this anxiety will increase that level of arousal. Another process that can kind of go alongside that is checking behaviours. So that's what we discussed just a minute ago surrounding kind of, is my throat feeling okay today? Okay, so, you know, is my breath feeling okay? Can I breathe? And again, by checking those behaviours, the almost subconscious process is that I'm not okay. So if I'm checking to see if I am okay, you know, obviously I'm going to be paying more attention to that, and I'm more likely, kind of like in the example, to find something that, you know, is maybe a little bit concerning. You know, if you kind of hold your hand against your chest long enough, there's likely to be a little bit of variation in breathing, in heart rate, or any real kind of physical change. So again, that's going to increase our levels of physiological arousal. And this can often lead into bodily preoccupation. So if we're consistently concerned about what's happening with our body, and we're shaking, we're feeling a little bit tense, naturally we're going to focus more on our body and what's going on to try and counteract that. Again, a natural kind of defense mechanism. And then this will lead back into our interpretation of symptoms equaling illness. So how we interpret what is going on in our bodies, dependent on that, will either increase or decrease our perceived level of threat. So if I put my hand on my chest and take a deep breath and think, well, that was a little bit of a struggle, more than I think it usually is, the natural train of thought might be, okay, well, is it a cold? Is it a virus? Do I have coronavirus? And because of that, coming back to the top, my perceived level of threat will then be, well, I have coronavirus. And again, this cycle begins again. So our worry and anxiety now maybe at 70, 80%. We'll be checking more, we'll be more physiologically anxious, and this cycle just becomes almost perpetual. And that's why it's so important within CBT to use some of these techniques to relax and to try and break that cycle. Okay. So having a little look on the on the flip side now, so how can we successfully and effectively manage our health anxiety? So with the amount of clients that I've seen with health anxiety, which is probably more than I can remember at the moment, I would say that 80 to 90% of those individuals live quite happy lives now without the presence of the health anxiety. Often the thought processes behind therapy don't need to be as dramatic or radical as we think they are. And the goal within what we're discussing today, within treatment, within everyday life, is that, anxieties around your health may come up. That is quite likely. And what is important and what we need to work on is when they do come up, what can we do? And hopefully we'll address a little bit of that now. So the example I quite like to give is overestimating the danger and underestimating coping. So often, we will, as human beings, overestimate what is dangerous because we want to protect ourselves from it. And often, because of the kind of stance that we place ourselves in, we often think that we can't cope with the situation when, in fact, if we look maybe historically, we usually can. So having a little look at overestimating the danger. So these are the questions on the left that I quite like to go through. So what is the worst that could happen from this situation? And more importantly, what is the likelihood of this happening? So often, and at the moment, and I think it's important to just briefly state that, even myself get concerned about coronavirus. I don't think that's unnatural or unusual. I think the majority of people that I know at the moment, if I asked, are you a little bit concerned, would say yes. So this is in no way, trying to overstep with supporting with health anxiety, but it's just best to rationalize it in a way that's going to be effective for you. So if we look at what is the worst that could happen and what's the likelihood. So the worst that could happen, most people will say, would be becoming ill, being admitted to hospital, and having some negative event occur there. However, I often like to look at what is fact and what is opinion. So facts are quite measurable, and our opinions tend to be quite subjective and not always quite true. So the fact at this moment, and whilst we're watching, whilst you're hopefully watching this webinar back, is: are we currently ill? Do we currently have the virus, or are we in hospital? Hopefully the answer to that at the moment is no. The worst case scenario hasn't occurred now. We're not in that worst case scenario. So often the kind of expression I would give is, why would we want to worry so much about it now in this moment? And then, even if the worst did happen, we would have to worry about it again. So putting yourself through the cycle twice isn't necessarily the best way of handling it at the moment. And then a little bit of information that is really useful is, what is the likelihood of this happening? So I'm not too sure where any of you will be watching this from at the moment, but obviously I'm in the UK. So we have around, I think at the latest, it was around 16 to 17,000 mortalities. So if we look at that in respect to, the population of the UK, which is around 66, 68 million, 15,000 is quite a small figure. And so if we look at the likelihood, often it's good to look at the individuals that you're surrounded by. So, are your neighbours, are your colleagues, friends, out of those individuals, how many people has the worst case scenario happened to? Often that is it might be one, it might be none, which is more likely. So why would they have why would you have a more reduced risk than any other individual? And if you look at the kind of statistics around that, the likelihood, and as we've seen from the stats anyway, is that there's more people that are recovering from coronavirus at the moment than are, becoming severely ill and unfortunately passing away. So if we look at, at the bottom aspect, so what evidence do I have that developing an illness will happen, for example? And, that's good to look at from a few angles. So what evidence do we have in this moment? So, most of us will not have a diagnosis from our doctors. Most of us won't even have symptoms at the moment. So the evidence, so it's important to have a little look at the evidence and weigh that up, and see, you know, how likely those events really are. And then, so having a little look on the flip side, so underestimating our ability to cope. So this is quite important, as it shows us, you know, when something does arise, how can we deal with it? So one way I like to look at this is, so has anything, or has something, let me just move this so you can also, so has something similar ever happened to us? So have we ever become severely unwell? Obviously, if you are watching this at the moment, then the likelihood that you have developed an illness and have, you know, gone through maybe an intensive care unit and passed away is minimal. So if you have gone through that before, how did you manage to get better? So, you know, have you had an operation? Have you been severely unwell? And fortunately, you will all be here still watching this. So how did you manage that at the time, and how did you manage to get through it? And another aspect of that is looking at what are we in control of? You know, obviously with the current situation, there isn't a whole level of control that we have with the illness or what's going on, the government response, what will happen with the flight providers, what will happen with the banks, the economy. So things that are out of our control are, to use the sort of phrase, out of our control. So having a little look at what is in our control is quite important. So a good way that we can do this is, if you have a sheet of paper, you can draw a big square on that, or a rectangle, and draw a circle in the center. So if you can make a note of everything that you are in control of in the center of the circle, and all the things that you're not in control of in the space in the square or the rectangle, then hopefully it'll give a little bit of insight as to what we can control in the moment, and, you know, what the steps that we can take if we do need to. And finally, looking at, you know, social support. So often, and I hope that many of you will have friends or family or colleagues around you at this time, and who will support you if anything did happen, and how would you be able to support yourself? So often there's individuals around us, you know, within the UK, we have the National Health Service who will look after us. And I hope that wherever you are watching this, that there's a good healthcare system that will take care of you, really. And that's not to say that there's also other individuals who can support you, so partners, friends, and again, looking at that, you know, has something ever happened in the past that we've managed to get through? Often I like to call them cookie moments. So a cookie moment can be something where you've experienced some hardships, or something that necessarily, you know, didn't go right. I have one for myself that I always like to think when I'm feeling a bit tired or a bit run down, of a time where I stayed up for 2.5 days on a work trip, and I managed to get through that. So if I can get through that, I can get through a 7-8 hour day. So it's just looking at the rationale of that, and not overestimating the danger, whilst not underestimating your ability to cope. Okay. So having a little look at acceptance and commitment tasks. So often within CBT, we try to change what we can, but in certain circumstances, there are things that we fundamentally just can't change. So that's where acceptance and commitment therapy comes in part. So these are some kind of quick and little tasks that you can do to try and resolve any anxiety that you might be feeling at the moment. So first of all, accepting help if it is needed. So at the moment, you know, there's a lot of nice things that are going on, particularly in the UK. We have a lot of individuals who are taking groceries and supporting individuals with their shopping. And it's important to, you know, if you do need help from, you know, your partner, your friends, and that can be as small as, you know, having a phone call over the weekend or during the week, then it is okay to ask for help. And, you know, as we all understand, it is a quite a trying and quite a stressful time at the moment. And then thinking about what we can and can't control. So back to the activity with our rectangle and our circle, having a little think about what is in our control and what we just have to accept that, you know, will come in time and that we don't have any control over. So then there's making committed actions. So this is where the aspect of commitment comes in. So we can make committed actions by saying, okay, so today I'm going to do X. So if I am feeling anxious because I'm a little bit concerned that I've been Googling my symptoms too much, or I've been looking too much into the news, I'm going to take a committed action to limit my social media use, to, I don't know, remove the web pages that are related to illness. I'm going to make a committed action to call my friend or call my partner or help someone who needs it. And by making committed actions now, we can start to resolve aspects of that anxiety. And then finally, so making a list of our values and moving towards them. So this is a little bit of a longer exercise in part. So if we imagine our values being from this end to this end, so these are values that I want to strive to be. So for example, I want to be a good son, I want to be a good clinician, I want to be trustful, honest, reliable. And on this side, we have aspects of our values that we don't necessarily want to go towards. So I don't want to be a jealous person, I don't want to be unfriendly. And if we have a look at listing our values, so what are important to us, so that could be from religion to exercising to anything that you value, really. And often, you know, when we are feeling anxious, we're moving more towards the values that we don't necessarily want. So by making a list of these values and determining that this is the direction that we want to go in, we can help almost become the person that we want to make sure that we are, and relieve a little bit of that imbalance that is going to take us towards reducing our anxiety. Okay, so part of acceptance is that sometimes, you know, things aren't necessarily in our control, and we can't control them. So when this does occur, we can always use some acceptance. So there's a lot of acceptance and commitment therapy tasks that are online. Quite a lot of it is free resources. So if you did want to know any more about this, you can have a little look into that. So often once we've accepted it, the best way that we can try and, you know, alleviate that anxiety is to distract ourselves. So some examples here, you know, do something you enjoy, do something fun, do something with others, or do something to give back. There's quite a lot of evidence, particularly with giving back, that it can help relieve our anxiety and actually make us feel a lot more kind of part of the community, to do something that we enjoy. So by doing something that is fun, so that could be, you know, from taking a walk through the park in places that you can, to, I don't know, playing a game or listening to some music that you quite enjoy. So by doing something and by distracting ourselves, we can change that focus of attention that we were discussing earlier to something that is more present and something that we want to enjoy more so than something negative and that we don't necessarily want to do, really. Okay, so quite a large aspect of health anxiety, and what I think is possibly the most important at the moment, is the awareness of social media and media in general. So if I tell you to not think of a white bear, and hold that thought for a second, the likelihood is that you will think of a white bear. So often telling ourselves not to do something isn't necessarily the best way of handling the situation, because it can draw us more towards it. Quite similar in children, for example, who you tell can't go out to play. Naturally, the first thing that they want to do is to go out and play more. So this is, again, looking at that selective attention, so what we're paying our attention to. So if we're attracted to negative information, we're likely to increase the problem. So a good example of this is I had a friend when I was younger who was a little bit younger, who used to drive a car, and he was very concerned about knocking the wing mirror off. So whenever he got in the car, he would constantly stare at this wing mirror, and because he'd stare at the wing mirror, he'd gradually drift slightly to this side of the road, and he eventually knocked his wing mirror off. So often when we focus on an aspect of something, we get drawn more towards it and can lead to those negative outcomes. So one way around that, and probably the best way, is to limit our use. So not totally eradicate, but to limit it to within a certain level that is comfortable, that is going to be, quite safe and isn't going to cause us anxiety. So there's no real set definition on how long this could be. Personally, I would recommend 15 to 30 minutes per day. So usually, and I mean, I do this myself, so I break up 2 pieces, so 15 minutes in the mornings and 15 minutes in the evenings. So I can get caught up on what's happening, what the latest news is, and what public health are saying with what's happening in the NHS. But I'm not spending 45 minutes and hours within the day looking at what is going on and focusing on that negative, which it often is in the news. And then the final aspect of this is, and I can't reiterate enough, is using reputable news sources without random Google searches, as I say. If you type pretty much anything health related into Google or to whichever internet browser you're using, you'll usually find yourself going towards something negative. And this is why it's so important to use reputable news sources. So for those in the UK, the NHS, Public Health England. For those of you who may not be watching in the UK, it will be your government provided information or your health service. And this is to really stay away from things like forums, articles that aren't necessarily relevant to what's happening at the moment, because it is, and it can be, quite a void of information that isn't necessarily true, isn't necessarily accurate. And obviously that will just continue to perpetuate the issue if we do focus on that. So just limiting our news intake to small little chunks and making sure we get it from reputable sources. Okay, so we're just coming towards the end of the session, really. So I just want to leave you with a good little technique that I use with the majority of my clients to help them kind of stop anxiety and to reduce anxiety within the moment. So this is what's called STOP with double P. And this is a practice to help reduce anxiety in the short to mid long term. So how this exercise works, and as you can see, is so we stop what we're doing. So these boxes in the right, I will usually ask yourselves, if you do have the time and want to write down examples of what we can do. So stop is the first thing that we need to do. So usually I like to use something that's going to kind of throw us into action and that is going to break that cycle of negative thinking. So typically the example I give is when you're in the car and you're going towards traffic lights and you have to hit that brake quite hard. And so when we hit those brakes, it's going to give us a little bit of a jolt, and that's going to be able to kind of stop us in our tracks. We'll then take a breath. So typically 4-7-8 breathing is the one that I like to use. So that's breathing in for 4 seconds, holding for 7, and slowly exhaling through pursed lips through the mouth for 8 seconds. So if you do get a chance, practice that. So 4 seconds in through the nose, hold for 7, and 8 through the mouth. And what that does is that helps activate the parasympathetic nervous branch. So that naturally helps us to calm down and slows down that adrenal system a little bit. So then we're going to observe the feelings, the thoughts, the sensations that we're experiencing at the time. And this is good as part of like a little bit of a journal, so to know what is happening and hopefully get a little bit of perspective on what is going on. Typically when we do write certain things down, they help us in kind of rationalizing them, and that is the thought behind that. So then pulling back and putting into some perspective. So when we spoke a little bit earlier about overestimating danger and underestimating coping, so this is often called the helicopter view, so taking a higher out view of what is happening and having a little look at the intricacies of it. So, do I actually have a cough? Am I likely to go to hospital? Am I okay at this current moment? And then finally practicing what works. So what's the best thing for me to do now? So this goes almost to the previous slide, which is that of, doing something we enjoy, doing something to help others, listen to music, watch a movie, and just do something that kind of gets us out of that cycle. And if you do want to find this form anywhere, if you just type stop into Google, I think Get Self-Help is where I got this one from. And it's quite a common activity that you can find through most providers. Okay, so that is all I'm going to be saying to you all today. I hope that's given you a little bit more information about health anxiety and how we can help manage it at the moment. So if you do have any questions about health anxiety in particular, or anything more you'd like to know, you can feel free to message me on my email there at the Oak Tree Clinic. So I'd like to just finally say that I hope you all stay well. I know it's a very pressing time, and I'm sure that we will all hopefully get through the end of it, and I look forward to hopefully everything returning back to normal. So please stay happy, stay healthy, and take care.